Hey YouTube, this is Marita from the Nurse Lounge, and today we're going to actually do something very different from my channel. We are going to do a video on representing minorities in nursing specialties today. And I have a fellow soror and a fellow nurse with me who is going to talk about her background in her specialty. So if you want to see what we're talking about today in this video, then stay tuned. So as you know, my name is Dr. Marita P, and I am a registered nurse, 16 years in the game. I am an OB/GYN well baby nurse and a nurse educator and nurse mentor. And I'm going to allow her to introduce herself and talk a little bit about, how many years she's been a nurse and her specialty.
Hi, I'm Tasha, and I am a certified plastic surgery nurse. I also work at Vanderbilt Hospital as an orthopedic nurse, and I have 15 years of nursing experience. I actually started off as an LPN and then went back to school and earned my registered nurse degree. And so I'm excited to be here. Thanks for having me, Marita.
Not a problem. So we're going to actually we're going to do like a question and answer, but we're going to answer the questions ourselves for you all. So you'll have an understanding about who we are, why. And first I want to preface this by saying why this video is important is because I want to be able to show that ethnic minorities can be in other areas outside of med-surg. And there's nothing wrong with med-surg, so I don't want anybody to say, well, I love med-surg. Do you? This video is more so about showing and representing that ethnic minorities can be in other areas of nursing. So as I was saying, there's nothing wrong with wanting to be a med-surg nurse, if that's what you choose to be, but I just want to represent or show that you can be in other areas of nursing outside of med-surg, and I just want to have a real representation of what that job is, what they do, and things like that. So before we get into the specifics of what we do, you all know I'm an OB nurse, and I'll get more into what I do on a day in and day out basis. But before we do that, we're gonna ask, I'm gonna ask her, or we're gonna answer the question, why be a nurse? What brought you to nursing? And I'm gonna let her go first.
Thank you. So I actually started off in the medical records department. So I was a medical records clerk, and I remember part of my job included getting charts together for a lot of the nurses and some of the physicians. And I remember two nurses specifically. They looked like me, and so it was really eye-opening to see these beautiful black women in these white coats coming in this professional environment. And it really inspired me to start thinking about what I wanted to do with my life on a professional level. At that time I was in school and I really didn't know. I knew I wanted to do something medical, but I didn't realize at that time that I could go in the clinical area. So seeing them really was eye-opening, because at the time the only nurses that I would see were my counterparts. So to see nurses that looked like me was very inspiring, and that is really what kind of turned on the light bulb for me. So I pursued it and started doing some research, and eventually got accepted into a nursing program, and the rest is history.
Okay, and so for me, as you know, I'm an OB nurse, and I didn't choose nursing, it chose me. I have a degree in psychology, and that's what I was pursuing at the time, but also being a single parent, I realized I needed something else to take care of my girls at the time. So I saw nursing to be an opportunity, basically, to have a job in which I would be able to take care of my girls and not be on government assistance. And basically, no matter what happens in the world, that I would still be able to work. And that's exactly what's going on today. If you think about it, no matter what, people are not working, but we are still working the front line due to this COVID situation. All right, so now we're gonna actually briefly talk about what we do in our specialties. So as an OB nurse, I take care of antepartum patients, postpartum patients. Sometimes I take care of labor and delivery, one-on-one patients, the ones on a max sulfate. I do well baby nursery, so those are the babies who are born healthy, who do not have to go to NICU. And I also take care of GYN patients, so female surgeries. So they typically have hysterectomies or bladder prolapses and things like that. They typically also have a lot of comorbidities, meaning they have other disease processes going on with them, which is basically like a med surge if you think about it. When I always talk about postpartum, I talk about it being a specialty med surge, because that's really what it is. It's a specialized med surge in which we take care of those type of patients, and they all happen to be women. So what do you do in plastics? What can we tell them about plastics?
Plastics is such a variety, a wide range of things. People often think of, tummy tucks or breast implants when they think of plastics. Plastics actually go far beyond that. You actually can do reconstructive surgery for burn patients. Patients that are undergoing mastectomy procedures for breast cancer are often seen by a plastic surgeon for reconstruction of their breast after their treatments. But we also do fun stuff like Botox, injectables, fillers, and things of that sort. Facials are also included. Skincare is a huge part of plastic surgery as well. So part of what I do is on the preoperative and postoperative phase of things. So I prepare patients for their procedures, make sure they're well versed on what to expect after their surgeries. During the process of that, I prepare their families for how to take care of them. And then afterward, I'm sort of the first face that they see. So I'm the person that will make sure that their drain care and their incision care is monitored. I'll be the person they'll talk to, answer questions about concerns, manage pain issues. And of course, in the long run, when they come back, we're taking those after pictures. So it's a very exciting job because people want to be there.
Okay, good. I never thought about facials being part of plastics. That's something even I just learned just now. So that's different. Because I think of going to like a Massage Envy or some place like that when I think of that. So that's something good to know, that you can get into that kind of specialty and to do something like that to make men and women feel better about themselves. Yeah. All right, so now we're actually going to move into the difficulties that we have within our specialties as a minority nurse. So this is specifically about being a minority nurse and the difficulties we have in our prospective specialties. So I'm gonna give her a moment to think, because I happen to know everything. In my area of nursing, I will have to say that you will not see, unless you happen to live in or be in a town like Atlanta that is just heavily populated with minorities, or other cities and states that's heavily populated with minorities. If you don't live in an area like that, or if you're not working at a county hospital, our local county hospital typically has a lot of minority nurses there. But if you're not working in those kinds of areas and you're working in maybe a large teaching hospital, or you're working in a community hospital, or just a demographic that doesn't look like that, you will not see ethnic minorities typically in OB, not a lot of them. You may see one or two, and I have to say, when I do see one, we tend to just gravitate towards one another automatically, like, oh my gosh, subconsciously, like, hey, what's your name, because there's only two of us here, or whatever. So to put things in perspective, at the at the facility that I work at, we have 4 units. We have postpartum, we have labor and delivery, we have nursery, and we have NICU. So nursery and NICU kind of work hand in hand, but there's still 4 separate units. Between those units, we probably have, I want to say, maybe 100+ nurses in all 4 areas, including day shift and night shift. If I had to guess how many actual nurses we have, now we have several division clerks. We have, we don't have techs on our floor, so we don't have that, but division clerks we have several. But when it comes to African American or minority nurses, period, on our floor, we probably have, if I had to count, probably around 15. So, and I think that's pushing it. I honestly think that's pushing it. I think we only, because on postpartum, we only have me, another nurse during the day. We only have 3 nurses on postpartum who are African American. 3. We have 2 in the nursery. We have 2 in labor delivery. That's not even 15. So 3, 5, 6, 7, 8. We have 8, less than 10. We have less than 10 nurses who work in 4 areas who have the total of 100 nurses, give or take. I'm not sure the exact number. less than 10 of them are black RNs on our floor. So that's just to show you what it looks like on our floor. And I'm sure there's different hospitals. I work at different hospitals where I was the only one for the entire day shift, night shift, whatever. I was the only black nurse. It is not that easy to get into OB, depending on where you live. And you know, when people are like, "How did you get into OB?" It was not easy. So you know, luckily they were hiring new grads at the point in time, and they needed some nurses, so they just hired me. But I got lucky. But you will not see a lot of us there. And so, besides that being a difficulty that we're not even present, another difficulty would be the fact that sometimes some of the patients don't think we know what we should know. You know, they think that I've had to tell them, you know, they said, well, do you even know, you know, how to take care of moms and babies? I'm kind of like, I've been doing this for 16 or whatever, how many years, 16 years. And I have 4 children of my own. So I do know how, you know, what it's like to be a postpartum mom. And I do know what it's like to take care of a newborn baby and everything like that. So it can be kind of difficult to deal with that. I will say it's very difficult to move up in management. Being a minority, you're fine as a staff nurse, but when it comes to you applying for that role, maybe you want to be nurse manager. I don't see, unless we're talking about the hospitals already specified in terms of being in Atlanta or somewhere like that, or and maybe because we're in the South, maybe that's what it is. I don't know. Maybe because I'm in Tennessee and I'm in the South, but we're not well represented in management at all. You may find one that may be a house supervisor from time to time, but outside of that, in some of these regular, community hospitals, you're not going to find us there. So room for advancement can be difficult in terms of management moving up in the hospital setting. What else? So we're not trusted by patients. Don't per se always like us. Nurses, because we are the only few black people there, and then we have a high population of African American patients. They don't know how to relate to the patients. And there's been times that it's not a racism issue, but they'll say, oh, that patient was difficult because, you know, and I get in there and nothing wrong with them, but besides them being black, the patient wise. So we catch it from all kinds of angles where, you know, like, oh, I'm not going to take care of that patient because they have the state insurance, what we call TennCare. And it's just like they don't give them the same kind of treatment. And so therefore they throw all those patients onto me as the nurse, you know, saying you can take care of them because, you know, they'll come up with some reason as to why I should take care of them. But I notice even when I get my patient assignment, sometimes the most difficult black patients, they give them to me. And maybe that's a good thing because of the fact that we can relate in terms of just being ethnic minorities. So sometimes what they do is a downfall for me is actually to a blessing to the patient, because the problems that they have with these patients, I typically don't have. I'm like, okay, look, this is what we gonna do, you know, and they like, okay, you know, they're like, okay. So that's a little bit about what the difficulties I have. Pay wise, there's not here in Tennessee, you just gonna get what that hospital pay. And it's not based on how many degrees you have. You're going to get what our RN skill set's going to be for that area. So pay is not an issue. I think we get paid relatively the same. Again, in terms of moving up into management, that's definitely an issue. Patient-wise, my Caucasian patients sometimes think that, you know, I look younger than I am, so they think that I don't know anything. I actually get it, too, from my African-American grandmas, meaning that my patient may be fine, but her mother may... you know, they may have a certain feel or way about me being black, and they'll say something like, oh, okay, well, is that true that this is how you do this? After I've already verified or talked about whatever procedure I needed to do. And they go and then ask the white nurse. That has happened plenty of times. The white nurse, the same thing that I just literally said, and the white nurse says the exact same thing. And so that's like a slap in my face type of thing. So there are some difficulties. Like I said, you don't find people who look like you there. But again, if OB is what you love, you know, or if you think you want to go into that, you want to help moms and babies, you want to be a agent of change for them, then that's what you need to go into. All right, so now we're going to go into plastics. What are your difficulties with your specialty?
I would definitely have to agree with you in terms of I would say breaking the glass ceiling, because getting into management or what we consider to be more leadership or higher level positions in plastics, I have personally found to be a bit of a challenge. In plastics, there's 2 ways to go in terms of moving up. You can go into leadership or more management type positions, or the alternative, which is like the ultimate, is to be a nurse injector. And a nurse injector is a very coveted position. It's a skill set that requires lots of training. You have to have a lot of experience with anatomy. You have to also have an eye for beauty and aesthetics. So it's not just the scientific part of it, it's really an artful eye. So it's a very trained eye. So there goes a lot into it. And needless to say, and this may sound, just a little bit superficial, but the fact is you do have to have a certain personality and a certain, you have to carry yourself, a confidence, because people are trusting you to make changes to something that you're going to see is their face. And so you do have to carry yourself in such a way that people will respect and feel confident in your hands when you're doing injections. So, and for me, being one of the very few African Americans here in Nashville, and I can say that, there are very few African American nurses in plastics in the Nashville area. You do not see a lot of nurse injectors, black nurse injectors. In fact, I can count 2 that I know. I was one of them. And there's another one that I know at another plastic surgery facility, but it's very rare. And I don't know if the bias or if that stigma has to do with the fact that there are not a lot of minorities in plastics to begin with, or if it's just a stigma that black women don't like aesthetics or that we're not interested in those types of things. But it is a very difficult, that is a challenge that I find, is breaking into either leadership positions or trying to get on the aesthetic side.
And if you think about it too, in nursing school is not something they even introduce. So that could be another thing too. We don't even I don't even think I knew that was an option. Not that I just don't think I knew that was an option out of school. Like who, that's something they tap into home health in school. Yeah. They tap into wound care. Yeah. They tap into hospice even. They tap into mental health, obviously, and various med-surg rotations, and obviously peds and OB. Right. But I don't recall them ever tapping into these specialties that you would never ever think about. They even tap into clinics. Think about it. We always go to pediatric clinics. We go to the OB clinics. We go to the health department for community health. We do all kinds of things, but they don't even talk about that specialty of plastics. So that's really good to know.
I think I had one paragraph on plastics in my med-surg book when I was in school, and that was in 2008. So
wow.
Yeah.
Okay. Yeah. So that perspective right there is definitely it's warranted and needed as to know that there are options for you if you decide that, you know what, I don't think I want to be, when I say traditional nurse, I'm not wanting to work per se in the hospital type of thing. So tips for getting into this specialty. I've always told people when it comes to OB specifically, utilize your opportunity in your clinical rotation. So if you are interested in going into OB and you're a nursing student specifically, I highly recommend that you definitely during your rotation, OB rotation, get to know the nurses, get to know, especially if you like this facility. So I'm speaking specifically if you like that facility that you did your clinical rotation at, get to know the nurses. Definitely do your best in that rotation. Ask for help. Ask, can you help them with something? Ask questions about how things are on their unit. What's the ratio in terms of nurse to patient ratio? For me specifically is 1 to 6. So therefore I have 6 patients. Acuity does not matter on our floor. So it doesn't matter if I have 6 fresh post-op C-sections. That's what I got. That's what I got, type of thing. We try not to do that to each other. We try to split it up, but there's some times where we have a 24-bed unit and we have 12 of those beds be fresh C-sections. So sometimes it's that rough, but find out what kind of patients do they have? Do they have patients with high comorbidities? Is it just a regular, do they do a lot of C-sections on that unit? Get to know the nurse manager, find out his or her name, write that down. Have a meeting with that nurse manager and say, or you happen to see them in the hallway, say, hey, my name is, and I'm thinking about coming into OB once I finish school. Do you all hire new grads? That type of thing. And if so, make sure you follow up and do whatever you need to do. Now, if you're not a nursing student, let's say you are already a nurse and you're wanting to transfer from med-surg, some other unit basically, into OB, I highly recommend you get to know the nurses on that floor in that hospital if you can, if it's within in-house transfer. If it's an in-house transfer, you currently work in ICU as an example, and you're now wanting to come down to OB, get to know some of those nurses on that unit. Also, be in contact with the nurse manager as well. Let him or her know that you're definitely interested in being an OB nurse. Let them know what skill sets you have that would transfer over into OB. Now, mind you, if you're doing ICU, you'll be fine, because we send some of our patients to ICU because the care that they require is higher than what we can provide on the OB floor. But I definitely recommend you basically meeting nurses, meeting the manager and getting to know them, and definitely watch your HR post for positions. And 9 times out of 10, they try to hire in-house before they hire from the outside. So you want to be on the lookout for those posts. Put an ear on somebody, get to know those nurses, put a bug in their ear saying, hey, you know what, when y'all get something, I want it. You may have to come to night shift, before you get to day shift, but that's okay, because you're just trying to get into OB. And then once they have a day shift position open, and if they don't do it based off seniority, then maybe you can move up when your time comes to move up. So just be mindful of all those things. I'm trying to think, is there any other tips for getting into this specialty? I think that's pretty much it. No, one more thing. Make sure that you have, if you get to know these nurses, make sure that you have someone who could be your reference for you, could vouch for you, could say, you know what, yeah, she's a ICU nurse or whatever, but she's great or whatever. For the nursing students, you want your nursing instructor, your clinical instructor. If she is someone or he is someone that would write you a good letter, usually when it comes to OB, hopefully they gave you a clinical instructor that actually does OB. Hopefully they haven't found somebody who just does med surg and OB rotation. Hopefully they found someone who does OB who is being your clinical instructor. If they have, they can attest to your skill level, whether you would be someone who would be strong enough, a good candidate, if you will, to actually do OB. And have them see if they will do a reference letter for you. Now, with that being said, you got to make good grades. You got to make sure you do what your nursing instructor says to do, because if they're writing you negative evaluations, there's no need of asking them. If you're coming to clinicals late, there's no need of asking them, because they will not vouch for you. Basically, when we do referral letters, because I get a lot of students who ask me for referrals, would I be a reference for them? And I'm kind of like, no, I can't, because you didn't come to clinicals on time. You did not do your work and things like that. So I cannot give you a reference when you're not referable, in my opinion. It's because of your professionalism or lack thereof. So your skill set may be fine, but I won't vouch for you. So be mindful that if that person needs to be a candidate who's going to speak highly of you to move into that position. So what tips do you have for people to get into plastics?
I would definitely say for new nurses, I actually would take a different approach with new nurses. I would say get on the floor. It is very imperative that you get some strong foundational skills as a floor nurse. I think that was where you're going to get your best experience as a nurse. That's where you're going to learn the most in terms of how to think critically. I will tell you, a lot of plastic surgeons, when they look at resumes, that is one of the things that they look at, is how much experience outside of maybe being in a clinic area or somewhere where you're not getting that acute care experience that you have. So really consider doing that for at least a year, if not 2 years, before going into a more specialized clinic area, because you will be more valuable and more marketable. For those who are already on the floor, maybe you're in a different specialty and you're looking to get into plastics, my suggestion is to break into a different specialty. I know Vanderbilt Hospital, they utilize a lot of plastic surgeons. We do a lot of reconstruction. We have a burn unit, so it's a little bit different setting. So I think it depends on the facility that you're with or that you work for that will help you break into that. I wouldn't say med surg would be the go-to in terms of breaking into plastics. I think it's helpful, but you probably want to go into some other form of specialized nursing in order to break into the plastic arena. And also, I think one great tool that people don't really think about is getting on social media sites. There are a lot of nurses that, especially plastic surgery nurses or cosmetic nurses, that market themselves on social media platforms. Follow those people. Ask questions. They love to teach. There's a lot of room for people to break into that, but you do have to show an interest and kind of get involved on that forum if that's something you're interested in doing.
Okay, something I didn't mention since she brought it up was, is it important? Nursing students have asked me this question, so since she brought it up, do you need to go to med surg first in terms of going into OB? No. the true answer is no. I came out of nursing school and went straight into OB out of nursing school. It's a specialty though. I had a student ask me via my email, she said, will I lose my skills from nursing school if I go into OB? Well, again, it's a specialty. Every specialty has something they specialize in, so you're going to lose something. Absolutely. So, and it depends on your demographic of who you serve too. I do high risk OB, so I did maybe 3 NG tubes in 16 years. So NG tubes, no, I'm not the one you want to do that. But we start IVs, we do catheters, we do wounds because the incisions are basically wounds. I've had wounds that dehisced or opened up, so we had to get the wound back and the wound nurse involved. And because people have comorbidities, I'm doing diabetes education, hypertension. I'm doing all that stuff is med surg. All of it's med surg. It just happens to be a woman. I'm doing blood sugars, post-prandial and before meals, and and we're doing sliding scales, and we have a hypoglycemic protocol. If their blood sugar drops below this or it's too high, we have all those protocols within OB. So for me personally, I don't care about the fact that I don't know, that you're going to have to teach me about what a central line and stuff is, because our patients don't even have that kind of stuff. And if she requires that, she doesn't need to be on our floor. So I'm okay with losing the few things, those kind of skills, but I do the basic nursing stuff. I know how to in and out cath someone. I know how to ambulate someone. I know how to pass 25 meds because they on all these medications. And I do that with my GYN surgeries a lot. A lot of times they're older women, 60, 70, 80 years old, who have their bladder done fell out and they put it back up in there. And so they on all these medications because they're just older, and you have to be mindful of, heart rates and blood pressures and side effects of medications. But do I think you'd be to your advantage to do med surg first? Yes, I do, just because it gives you a foundation into nursing. It's very much a nursing foundation, and it also helps you learn your time management, prioritization, and organizational skills. So, and that's something you need in every area of nursing. And if you learn how to prioritize, what should I do first? Organize. I don't want to go in that room 15 times, which as a nurse, we did that all the time. I do that even being PRN, where I'm like, okay, I haven't worked in a month, and I'll go do something like, shoot, I forgot, I got to go back and do this. And then after a while, I'll get back into it. But time management, prioritization, organization are a must for OB. And they're also a must for med surg, and frankly, any other position you have, in the hospital, so, or anywhere, really, anywhere. You have to, if you did home health, do I go to the furthest house out first, or do I go to the closest house to my house? How do I do that? So that's time managing, that's prioritization, and being organized, so you're not doing this back and forth. You go to this side of town and come back on this side of town, like, oh, I forgot to go back to that side of town. You're wasting time, money, and energy. So, yes and no. So if you happen to not know what you want to do, I tell people go into med surg automatically. Go to med surg if you don't know what you want to do. But if you want to be OB nurse and you know that's what you want to be, and they hire you as a new grad, then go where you want to go, because you're specialized at that point in time, and they will teach you what you need to know for OB. And I still have to float to med surg. And I hate it when I float to med surg, but I have to float to med surg. And so when I float to med surg, I only float as a tech. We don't float as nurses, as a high functioning tech. So I will pass meds that I'm familiar with. I'll pass DIG. I'll pass blood pressure medications I'm familiar with. I'll pass antibiotics and Motrins and colases and, cholesterol meds. I will do all those things to help the nurse out, but I'm not required to at my facility. And to protect my license, half the time I'm like, no, I'm not doing all that. So, I'll just function as a tech. All right, so that kind of finishing up this video. But the last thing we want to talk about is so future career and academic plans. So as you all know, I've already just graduated on April 28th of 2020 with my doctoral degree, DNP. And so for now, I have a video up on my next plans, but in general, my next plans are to rest mentally for the next year or so, and then maybe get into doing consultation. And I do tutor, I do mentor, I do those things, but outside of that, just kind of resting and doing that. As far as academic, maybe certification, kind of academic career certifications, I plan on doing probably in a year or so to get my certification in maternal newborn nursing and as a nurse educator. And so certifications are important. She has a certification, but I don't, so. She
has a doctoral degree.
So, I think that's next for me, is to potentially get me a certification in those areas. But again, I'm not in a hurry. I just need to mentally rest at this point. And then in terms of career wise, I'm going to move slowly out of bedside nursing. I probably will still stay PRN, but I'm going to move probably out of there a little, more, and kind of focus on being full-time academia or some type of something that's going to utilize my DNP degree. I'm not going to stay. I'm at a point now where I need to move to where my degree is, and so nothing towards bedside nursing at all. But once you get a DNP, you can still work there, but you need to be utilizing that degree. You don't spend all this money to get a degree just to stay as a bedside nurse, unless that's what you choose to do. But for me, that's not for me. So I'm going to actually move on eventually. All right. So for you,
yes,
what's going on?
For me, this is a time of reflection. I am actually at a point in my career and just personally and professionally trying to decide where do I want to hang my coat, so to speak, where I want to spend the rest of my career. I've been in nursing for 15 years, and I'm just at a point where I'm ready to sort of, say this is it and really put my foot into it and hopefully excel in some leadership capacity. So right now it's a time of reflection and just trying to decide, what does that look like for me and how to get there. I'm also focusing on my education endeavors as well. I am currently enrolled in school. So hopefully, fingers crossed, 2021, I will be finished up with school and can continue in my nursing endeavor or my education endeavors as well. But as far as professionally in my job, I'm just reflecting right now and trying to decide, where I want to hang my coat and where, as far as what role in nursing. So.
Okay, so this concludes our video. I want to thank my guest today for definitely doing this video with me, because I want to be able to show, for one, the issues that we have in nursing, and then shed light onto different specialties that you can go into. I plan on continuing this where I will have different people either do it in this forum or someone where I will send them questions and I'll put clips in of what they said regarding that. So this may be a new series for me, who knows? But I, again, want to shed light onto the fact that you can be anything that you want to be in nursing and just kind of show people that. So if you want to contact me, I have my IG either in the description. It's also in the YouTube banner above. And she has okayed for me to put her IG information. So that way, if you want to follow her as well on her page, you can go maybe DM and ask questions regarding plastics if there's something that you think you want to do, or just whatever else you think you may want to talk about. I think that's it for today. So I thank you all for watching this video. I need you to comment, like, share, and subscribe to this channel. And until the next time, y'all take care. Bye.